Welcome to this comprehensive medical training session. Today, we embark on a journey to master essential medical procedures and clinical skills crucial for exemplary patient care. Throughout this program, you will gain insights into fundamental techniques that form the backbone of our medical practice. From hand hygiene to advanced clinical interventions, every step is designed to enhance your proficiency and confidence in the field. Our aim is to equip you with the knowledge and skills necessary to deliver the highest standard of care. Your journey to excellence starts now. Welcome to Module 1, Basic Clinical Skills. In this module, we will delve into the essential skills necessary for effective patient care, starting with hand hygiene. Proper hand hygiene is the cornerstone of infection prevention. We will thoroughly explore techniques to ensure your hands are clean before any patient interaction. Next, we'll learn how to measure vital signs accurately, including taking blood pressure, checking the pulse, and recording the patient's temperature. These skills are vital for monitoring a patient's health and making informed decisions. Finally, we'll examine the basics of patient interaction. Effective communication with patients builds trust and significantly contributes to their comfort and overall care experience. Learning how to engage with patients compassionately and professionally is crucial. Mastering these basic clinical skills sets the foundation for providing high-quality patient care. Stay focused as we explore each aspect and practice diligently to refine your techniques. Now, let's get started by looking at the importance of hand hygiene. Hand hygiene is crucial in preventing infections. In this segment, we'll cover the importance of hand hygiene and delve into the proper steps for hand washing. Start by wetting your hands with clean water, applying soap, and scrubbing thoroughly for at least 20 seconds. Next, we'll discuss the effective use of hand sanitizers when soap and water aren't available. This simple yet vital practice safeguards against the spread of infections, ensuring both patient and personal safety. These basic skills integrate into more complex patient care procedures. Next, we will learn how to measure vital signs accurately, including blood pressure, pulse, and temperature. These fundamental tasks are crucial in assessing a patient's current health status. First, we'll dive into the process of measuring blood pressure. Understanding the correct technique in using a sphygmomanometer ensures accurate readings, which are vital for diagnosing and managing health conditions. Following that, we will explore how to check a patient's pulse. Knowing where to feel for a pulse and recognizing both rhythm and strength can provide immediate insights into the patient's cardiovascular health. Lastly, we will cover the methods for recording body temperature, a key indicator of a patient's overall well-being. Each of these measurements plays a critical role in the early detection of potential health issues, guiding treatment decisions, and monitoring progress. Accurate measurement and recording of these vital signs are essential skills that must be mastered to ensure the best patient outcomes. As we move forward, you'll see detailed demonstrations, allowing you to gain confidence and precision in performing these vital checks. Effective communication with patients is key to their care and comfort. In this module, we'll explore essential techniques to build rapport and ensure patient comfort. Understanding your patient's needs and concerns starts with active listening and empathy. By making them feel heard and respected, you foster trust and cooperation. You'll learn specific strategies to communicate clearly and confidently, ensuring every patient interaction is positive and productive. It's not just about diagnosing and treating, but also about connecting and comforting. Let's delve into the art of conveying compassion and professionalism in patient interactions. In this module, we will delve into advanced clinical skills, an essential part of complex patient care. First, we'll address intravenous insertion, a critical procedure for providing medications and fluids directly into the bloodstream. Mastering this skill not only ensures patient comfort but also prevents complications such as infections or improper placement. Next, we move on to wound care. Proper wound management is vital for promoting healing, preventing infections, and minimizing pain for patients. We will explore techniques for cleaning wounds, choosing the right dressings, and monitoring the healing process. Lastly, administering medications accurately is paramount in patient care. This includes understanding different types of medications, routes of administration, and calculating dosages correctly to avoid errors. These advanced skills build on your foundational knowledge and are crucial for managing more complex patient scenarios effectively. You'll see detailed demonstrations of these advanced clinical skills in action. Stay focused and ready to enhance your expertise in these critical areas. Intravenous 4. Insertion is a critical skill for any medical professional. Let's dive into the proper technique, starting with preparing the foresight. Begin by gathering all necessary equipment, ensuring everything is sterile to prevent infections. Identify a suitable vein and apply a tourniquet to make the vein more prominent. Clean the area thoroughly with an antiseptic solution and let it dry. Hold the catheter at a 15 to 30 degree angle to the skin, with the bevel up. Carefully puncture the skin and the vein, watching for a flashback of blood to confirm vein entry. Once you see the blood, advance the catheter a few millimeters further, then slide the catheter off the needle into the vein. Monitoring the 4 is essential to avoid complications. Secure the catheter with an adhesive dressing and regularly check the site for signs of infection, infiltration, or phlebitis. Make sure to flush the line according to protocol to maintain its patency. Monitoring the 4 ensures patient safety. Let's continue building on these skills as we explore wound care techniques next. Effective wound care is vital for patient recovery. In this segment, we'll delve into key techniques to ensure optimal healing. Let's discuss the importance of cleaning the wound properly. Proper wound cleaning is the cornerstone of effective care. It prevents infection and sets the stage for healing. We'll go through the steps to clean wounds meticulously, ensuring no debris is left behind. Next, we turn our attention to applying dressings. Choosing the right dressing is crucial. A good dressing protects the wound, absorbs exudates, and maintains a moist environment conducive to healing. We'll explore different types of dressings and their appropriate uses, along with best practices for application. Finally, monitoring the healing process is essential. Regular assessments of the wound site help detect any signs of infection or complications early, allowing timely intervention. We will cover how to monitor and document wound healing effectively, ensuring the patient is on the best track to recovery. As we move forward, you'll see how these techniques integrate with other clinical procedures for comprehensive patient care. Stay attentive as we continue to build on these critical skills. Administering medications safely is one of the most critical responsibilities in patient care. In this segment, we will delve into the various types of medications that medical professionals encounter daily and the different routes of administration. From oral and intravenous to intramuscular, each route has its own set of considerations and techniques. It's essential to understand that each route requires a specific approach to ensure the medication's efficacy and the patient's safety. Finally, we'll guide you through the complexities of dosage calculations. Accurate dosages are fundamental to effective treatment and avoiding potential complications. By mastering these elements, you will enhance your ability to administer medications safely and with confidence. You'll see how these principles apply in real-world scenarios, preparing you for a wide range of clinical situations. In this module, we delve into emergency procedures, essential for every medical professional. We'll start with CPR, a critical life-saving technique. Learning the proper steps and timing for chest compressions and rescue breaths can make the difference between life and death. Next, we'll cover defibrillation. Using a defibrillator correctly is crucial during cardiac emergencies. We'll guide you through the process of operating the device, adhering to safety precautions, and providing post-defibrillation care. Finally, we'll explore emergency airway management, ensuring patients have a clear and open airway. You'll learn how to assess the airway, use various airway devices, and maintain airway patency under pressure. These skills are fundamental in emergency situations, where every second counts. You'll see demonstrations and practical tips to help you execute these procedures with confidence and precision. Let's enhance our emergency response capabilities together. In this segment, we delve into the life-saving technique of cardiopulmonary resuscitation, or CPR. CPR can mean the difference between life and death in critical situations. Let's break down the steps to ensure you are prepared to act decisively and effectively. First, assess the situation to ensure the area is safe for both you and the patient. Approach the patient, tap their shoulder, and ask if they're okay to check responsiveness. If there's no response, call for emergency medical help immediately. Now, position the patient on their back on a firm surface and begin chest compressions. Place the heel of one hand on the center of the chest, place your other hand on top, and interlace the fingers. Keeping your arms straight, push hard and fast at a rate of 100 to 120 compressions per minute. Allow the chest to recoil fully between compressions. After 30 compressions, it's time to give rescue breaths. Tilt the patient's head back slightly, lifting their chin. Pinch the nose shut, take a normal breath, and cover their mouth with yours to make a complete seal. Give 2 breaths, each lasting about 1 second, watching for the chest to rise. Continuing this cycle of 30 compressions and 2 rescue breaths is critical until professional help arrives or the patient starts to show signs of life. As we proceed, you'll encounter more scenarios where CPR can be a vital skill. Your proficiency in these steps could one day save a life. Defibrillation is a critical skill every medical professional must master. In this segment, we'll delve into the effective use of a defibrillator. First, we'll discuss the proper steps for using a defibrillator and ensuring patient safety. It's essential to follow these guidelines meticulously to maximize the chances of patient survival. We'll also highlight key safety precautions to protect both the patient and the medical team. Lastly, post-defibrillation care is just as vital. We'll cover the steps necessary to monitor the patient and provide continued care after defibrillation. You'll see how these techniques integrate with other emergency procedures. Managing the airway in emergencies is vital. Here, we'll focus on 3 critical components: airway assessment, using airway devices, and maintaining airway patency. First, assessing the airway helps identify any obstructions or abnormalities. Next, we'll introduce various airway devices that can aid in keeping the airway open. Finally, maintaining airway patency ensures continuous airflow and patient stability. You'll see how these principles are applied in real-world emergency scenarios, enhancing your confidence and competence in emergency airway management. Welcome to Module 4, Patient Care and Management. In this segment, we will delve into the core aspects of comprehensive patient care. Patient assessment is paramount. Accurate assessment forms the foundation of effective care, enabling us to identify the patient's needs and condition accurately. Following this, care planning becomes essential. This involves developing tailored plans that address the patient's specific health issues and setting achievable goals. Effective care planning ensures that each patient receives personalized and targeted treatment. Lastly, patient education plays a crucial role in the overall management process. By educating patients, we empower them to take charge of their own health, improving outcomes and health literacy. Educating patients enables them to understand their conditions, treatments, and the importance of adherence to their care plans. Throughout this module, we'll emphasize the integration of these 3 key components: assessment, planning, and education. Together, they form the backbone of quality patient care, ensuring that we address both the medical and educational needs of our patients. As we move forward, we'll explore practical techniques and strategies for mastering these essential elements of patient care and management. Patient assessment is the first critical step in patient care. We'll begin with an initial assessment to establish a baseline. It's important to observe changes through ongoing monitoring, ensuring no detail goes unnoticed. Lastly, documenting these findings accurately is vital. This thorough approach ensures we provide the highest standard of care to our patients. You'll see how care planning builds on these assessment techniques to create effective treatment strategies. Care planning is essential for patient management. In this segment, we will focus on developing care plans, setting achievable goals, and evaluating outcomes. Effective care plans are tailored to each patient's unique needs, ensuring a structured approach to their care. Setting clear, realistic goals helps guide the treatment process and ensures all team members are aligned. Evaluating outcomes allows us to assess the effectiveness of our plans and make necessary adjustments. Keep in mind how integral care planning is to patient success. Next, we will explore patient education, a key component in empowering our patients. Educating patients is a cornerstone of effective healthcare. It enhances health literacy, allowing patients to make informed decisions about their care. By empowering patients through education, we build their confidence and foster better health outcomes. In this segment, we'll explore strategies for educating patients, improving their health literacy, and empowering them to take control of their health. As medical professionals, your role in this process is crucial. You'll see how patient education fits into the broader landscape of patient care and management. Let's recap the key points we've covered in this training. We delved into hand hygiene, measuring vital signs, patient interaction, advanced clinical skills, emergency procedures, and patient care management. Practice is essential to mastering these skills. Keep honing your abilities to ensure the highest standards of patient care. Your dedication to continuous learning and improvement is commendable. Thank you for participating in this training session. Stay committed, stay proficient, and continue making a difference in the lives of your patients.